Welcome to the UNITAR-UN Women, University of Tokyo Global Forum on Leadership of Women and Girls with Disabilities in Building Back Better towards an inclusive, accessible and sustainable post-COVID-19 world. We are indeed at the cusp of a new global order. The Secretary General has said this is our 1945 moment. And it is so, because after the Second World War, leaders from across the globe came together to design a new set of institutional structures to enable the post-war world to collaborate towards building a shared future. The world has changed, and as a matter of urgency, we need to collaborate towards once again building a new global order and a shared future. As we mark today the International Day of Persons with Disabilities and the COSP13, the theme this year is Building Back Better towards a disability inclusive, accessible and sustainable post-COVID-19 world. I want to start by mining this moment in history. As we know, here in the United States, the first woman and the first woman of color vice presidential candidate has just been elected. And she said at her first public gathering as the vice president-elect, Black women, Asian women, white, Latina, and Native American women throughout our nation's history have paved the way for this moment tonight. I think it is important for us to understand that her victory is the victory for all women, and women around the world share in that victory, including women and girls with disabilities. And this year, the year 2020, will be the year we look back on the year that changed everything. The dual forces of the pandemic and the mass public reckoning on gender and race and ableism have exacerbated the fault lines and revealed new economic, political, racial, social, ableism and gender divides. Without bold steps, we see that we can roll back the progress we've made towards diversity. But if we rise to this moment, we can lay the foundation for a more equitable workplace and a more equitable world in the long term. As the Secretary General has said, we have a unique opportunity to design and implement more inclusive and accessible societies. It is indeed a wake-up call for us. This moment in history, this moment of the dual forces of the pandemic, and the dual forces of the economic crisis, as well as this global public moment of reckoning, is a wake-up call. And no one is experiencing business as usual, but women, especially women with disabilities, have faced distinct challenges. So how can we rise to this moment? First, a few strategies. Klaus Schwab, the founder and CEO of the World Economic Forum, along with other business leaders, has spurred into motion the project on the Great Reset, along with His Royal Highness, the Prince of Wales. And he will convene a twin summit on the Great Reset in the World Economic Forum in January. And he has said the pandemic represents a rare but narrow window of opportunity to reflect, reimagine, and reset our world. But the most urgent call today is how can we reset? How can we put into motion this great reset by including persons and women with disabilities at the table? There is still a conspicuous absence of persons and women with disabilities at the leadership table at the corporate or board level. According to a Stanford Business School study titled Diversity in the C-Suite, there's a dismal state of diversity among Fortune 100 companies. 1 in 4 companies in the group still have an all-white executive suite. It is time that the C-suite be more diverse include not just women, but women with disabilities. How do we then change the image of power to make sure that we see power in different ways? As Vice Presidential-elect Kamala Harris has said, see yourself in a way that others may not have seen you because they've never seen it before. So I urge a more intersectional approach at this time of change. It is a time to renew our faith in democracy. And as the triple forces of COVID, in economic instability, and the global reckoning on equality sweep the world, we also see that the public reckoning has unleashed commitments by businesses to address equity issues, including a commitment of up to $500,000. But what we need to see is that this must also include commitments and a dedication to all aspects of equality, including women with disability. So finally, before I turn to our esteemed panelists, I want to remind ourselves that historically pandemics have forced humans to break with the past and imagine their world anew. And as Arundhati Roy, the great Indian writer, has said, this particular moment in history is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and our hatred, our avarice, and our dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it. So today, at this side event, we are fighting for this new moment and this new world. And we have with us a group of very esteemed panelists who are going to share ideas on how we can fight for this new world and how we can reimagine this new world. So I am going to start with the first panelist. The first panelist will be a very esteemed Dr. Abdul Hasnat Manjur Kabir, who is the Global Advisor for Gender Equality and Disability Inclusion at the UN Women. Dr. Abdul Hasnat, I want you to address the fact that disability is only one axis of difference. Factors such as gender, age, and location compound discrimination. And these factors also impact people with disabilities and their life experiences. UN Women has profiled the Haitian Secretary of State on Disability, who has reported that COVID-19 has worsened the situation of women and girls with disabilities who are experiencing sexual violence at much greater rates and are suffering greater economic hardships. So at this moment in history, how do we address the ways in which COVID-19 has deepened the fault lines and have exacerbated inequality, especially women with disabilities and girls with disabilities? So in Building Back Better, how do we address the fact that women and women with disabilities are often at the threat of experiencing sexual violence, and economic hardships? Dr. Abdul.
Thank you very much. And I would just take a second to correct. I think if you, Abul Hasnat Manjurul Kabir. So Abul Hasnat is fine, or Manjurul, not Abdul. Thank you very much. It's always a pleasure to interact with colleagues and partners from civil society, from other part of the system. And it is always reinforcing. I have been during last couple of days in several events, so I would not repeat this similar messages that I have heard or I personally delivered. And I thought I'm also looking forward to hearing you. I think in response to your question, it is not something that we suddenly wake up in the morning and realize that discriminations are happening. This is a pre-existing condition, as you say in US, right? In the medical term, where you have the discrimination existing. And while we are always advocating that violence against women, women with disabilities are, there is a risk that it is happening more frequently than ever because of the specific situation we all are in, because of the lack of ability for individuals to go out and seek recourse in this particular strange situation. We are in a pandemic. So that always raises the opportunity or chances that a certain segment of the population would be further marginalized and discriminated against. The reason I'm saying this, I also hear a lot of speeches at different forums where this thing came up, and people typically start attributing everything to pandemic. And it is not, because if you look at our behavioral pattern over century, this is the same thing. And so I think for us, as UN Women, it is important, while recognizing the specific challenges of pandemic, it's also important for all of us to take a stock and see that this is happening for over a period of time. We haven't seen enough attention by member states, by civil society to some extent, by media, by other powerful actors, by religious institutions, by different groups in the society who matters, whose opinion matters, whose influence matters for the life and work of person and women with disabilities. That is one thing I just want to set very clear. May I ask how much time I have? So I'll just.
You have 5 more minutes.
Okay, so I'll finish by 8:52 New York time. So that is at the outset.
So in about 4 minutes, we are running behind. 8:48.
Yeah, I can finish
by 8:48.
I can finish by 8:47 this minute. So my point is, one is to recognize that this is a challenge which we will have to overcome in the same speed that we overcome in late 90s, when gender equality becoming the bigger problem for the system, lack of it. And when we look at the representation issues, you mentioned about C-suite, representation issues in parliament, there have been a number of global survey we did together with Inter-Parliamentary Union. And while number of women has increased, we also face the challenges how women can play a more powerful role within parliament. So it's not about the only women for the sake of women being in parliament. We also want to have a meaningful role in the standing committee, in the decision-making forum inside parliament. At the same time, we want more women with disabilities, but we also don't want them to really be frustrated in an environment where people would see them as a kind of showcasing women with disability. So doing the right thing, ticking the box, more of a expression of charitable, that is the last thing you want, because that is not reasonable accommodation. And I think the greater challenge that system and civil society organizations are facing is how really you meaningfully change the management pattern internally organization and internally ministries and member states and in the planning process, number one. Number two, while you change the inclusive management pattern of an organization, how can you also demonstrate the behavioral change that is something you are doing deliberately, consciously? I think the critical discussion that is happening now in US on the race matters. It's also an example where so many training have done for law enforcement officials, not only in this country, but in other places. But does that lead to meaningful change? And is capacity building enough? Similar thing we have seen in the in early years of this century on human rights. A lot of human rights training went into for law enforcement and civil administration officials. And that didn't result into something we all hope for, more pro-human rights friendly law enforcement judicial operatives. So I would sort of say that in that light, one is this recognizing this pandemic and specific challenges it really poses for women with disabilities, but also how this can be continued as a sustainable behavioral and management change. And I'm keep focusing on management because While it is important, we must have dedicated resource allocation and tracking of resources and tracking of expenditure on specific cases of women with disabilities. In the same way, World Bank and IFI promoted in the early 21st century public sector review and public sector expenditure review. We have to look at how disability marker can be used and expenditure and when investment made, because participation and inclusion is not free, in the same way that human rights-based approach was never free. So how can we track the progress and how can we track the resource allocation that were made by the government and other sectors? And UN Women is particularly interested in this, and we are looking forward to partnering with you on this. And I just want to also highlight that if there is a global forum for women with disabilities, as we supported in the past, we'll continue to support and engage with you with our limited capacity. It's a very humbling capacity. We haven't done enough, and we have to do much more. And I think that is true to all UN organizations. We haven't done enough. And whatever we are doing is still a drop in the ocean, because the needs and the challenges out there is so much that we are doing only a little part of that pie. And I would urge all of you to do more in that. And in addition to the resource allocation, I'm just highlighting as a closing point of my speech is, how can we change our management practices? How can we change the way we look at disability inclusion in our organization, in our society, in our families? And we also need to make sure that the disproportionate care burden doesn't land in women's lap, because they might be mother of a son or daughter with disability. They might be the caring spouse in a family who is providing care for herself or her husbands. That is the status quo in the society in many countries. So we have to make sure that women doesn't bear the brunt alone. Men and women and others, non-conforming gender entities, have the equal share in this burden sharing. So while we are focusing on state's role, we also want to see that family also demonstrate their change behavioral pattern to make this a meaningful engagement. Thank you so much for inviting me and the opportunity.
Thank you, Dr. Kabir, for your perspicacious ideas and a vision for rebuilding better. So as you mentioned, what this moment in history has done is to deepen pre-existing disabilities, pre-existing inequities. And you emphasize the fact that these have existed historically, and that what has happened and what will continue to happen if we do not reimagine the world is that these pre-existing issues will not only deepen, but that we also face the threat of rolling back the progress, reversing the progress that UN Women and other multilaterals have made on this issue. You also mentioned the importance of having women and women with disabilities at the table. So nothing for us without us. So it is not about making policies and developing programs for women with disabilities, but ensuring that women with disabilities are at the table and at the highest seats in decision making, in parliament, in the C-suite. And that they need to ensure that the commitments that have been made by governments and business entities, never in history have we seen such huge financial commitments, but whether those commitments will be actualized in reality, and that these commitments will make a difference in the lives of women with disabilities need to be seen. And major multinational corporations like Microsoft have made commitments for women with disabilities and to create new tools to ensure the rights of people with disabilities. But we need to be constantly, as you have pointed out, Dr. Kabir, monitor the progress and to ensure the actualization of these rights and commitments. And then finally, you focused on the importance of addressing the rights of all women. As you said, there is a disparate way in which caregiving in a COVID and post-COVID world will further marginalize women and women with disabilities as caregivers and exclude them from the public sphere. So how do we address both the rights of women and women with disabilities and the rights of the caregivers in providing the care for all, including those with disabilities? So these are important framing questions, and we hope to continue this discussion with the other esteemed panelists. I next turn to Ms. Riznavati Utami, who is the expert committee member of the United Nations Convention on the Rights of Persons with Disabilities. Now, as we know, the CRPD is the first human rights convention of the 21st century, and it is one of the most widely ratified conventions, with 180 nations having ratified the CRPD. So, Ms. Utami, as an expert committee member, how do you think the CRPD can be a powerful tool to ensure the rights of persons with disabilities as we build back better? The CRPD is the Bill of Human Rights for persons with disabilities. And it is the standard setting guidelines that need to direct the actions of all state parties. So how can the CRPD become the accountability measure to ensure that we hold governments accountable to the rights under the CRPD as we build back better? Dr. Utami?
Thank you, Dr. Ranggita. This is very great opportunity for me to share all of you. And first of all, I would like to thank you that I would like to share about the importance of the leadership roles of women and girls with disability in terms of how to deal and mitigate with the pandemic in the lens of the Convention on the Rights of Persons with Disability. We know that the roles of women and girls with disability in the implementation of the convention is very critical, and it has direct impacts in implementing the Agenda 2030, in particular to make disability inclusive in real life, in the development. As we know, and it's also mentioned clearly in Article 6 of the Convention and the General Comment number 3, 2016 on women and girls with disability. And these are human rights instruments and development tools that we need to advocate and to strengthen the leadership roles of women and girls with disability across the globe. As Dr. Ranggita mentioned, it is the widely ratified convention across the world, and now actually is more than 180 countries ratified the convention. And there is a strong evidence to show that women and girls with disability face barriers in most areas of life. The pandemic has even more increased the multiple barriers and intersecting forms of discrimination against women and girls with disability. In particular, equal access to information, education, economic opportunities, social interaction, healthcare, and social protections, including the ability to exercise control over their own lives across a range of contexts. For example, with regard to healthcare, access to COVID-19 testing and reproductive health services during the pandemic are getting more challenging. Article 6 of the Convention on the Rights of Persons with Disability is a response to the lack of recognition of the rights of women and girls with disability, and to reinforce the non-discriminatory approach, in particular and respect women and girls with disability. This article requires that all state parties go beyond refraining from taking discriminatory actions to adopting measures aimed at the development, advancement, and empowerment of women and girls with disability, especially in addressing disability inclusion, in gender equality and the Agenda 2030 implementation, and of course, in post-COVID-19 world. The other critical aspect in Article 6 of the Convention requires that the state party need to strengthen the promotion of measures to empower women and girls with disability by recognizing them that they have distinct rights holders, also providing channels to have their voice heard and to exercise agency, raising their self-confidence and increasing their power and authority to take decisions in all areas affecting their lives. And in the CRPD and general comment also recognize that gender equality is central to human rights. Equality is fundamental human rights principle that is inherent and context specific. If the recognition of the rights of women and girls with disability exists, it can increase the leadership role of women and girls with disability to contribute in all development sectors. And I would like to share one example of the study of rapid assessment on COVID-19 impacts on persons with disability in 32 provinces in Indonesia, conducted by the Organization of Persons with Disability Coalition. The study found an interesting finding that persons with disability making a high contributions, including women and girls with disability and their representative organization and the COVID-19 response and recovery. And the study says that more than 66% of total 1,683 respondents, including women with disability and their representative organization, reported they are willing to contribute in any way they can, including donation, gathering data on persons with disability who are impacted the pandemic, education to the community, making the masks and other self-protective tools during the pandemic in Indonesia. The study also found a number of local DPO, including women with disability organizations, which have been working on a number emergency response in the COVID-19 response and emergency. The interesting part of the study also provide recommendation of the government to take into account of active contribution and participation of all organizations of persons with disability, including women with disability, in the government task force of COVID-19, especially to develop inclusive action plan of COVID-19 emergency recovery and response in Indonesia. Maybe this example is only a few examples that can be articulated by diverse stakeholders, including state party, to imply that active participation and involvement of women and girls with disability are having direct impact on the life of all persons with disability, their community, and even in their country level. Therefore, understanding and implementing the principle of the Convention on the Rights of Persons with Disability, as it stipulates in Article 6, should guide state parties to comply with their convention-related responsibilities to continue promoting, protecting, and fulfilling the human rights of women and girls with disability from a human rights-based approach and a development perspective. Lastly, we need to work together to continue strengthening the leadership role of women and girls with disability to make a significant contribution in building back better toward an inclusive, accessible, and sustainable post-COVID-19 world. I thank you.
Thank you. Thank you, Dr. Utami. This was such a panoramic sweep of the CRPD and the analysis of Article 6 and the general comment in 2016. I am very grateful that you emphasized throughout your comments the importance of leadership. And I like the fact that you put the issue of women and girls with leadership at the forefront, because it is no longer about even the participation. It is about the leadership. It is about women and girls with disabilities taking a leadership role. It's not mere participation, but being at the head of the table. I would also like to add that the Convention on the Rights of Persons with Disabilities must be read together with the CEDAW, or the Convention on the Elimination of Discrimination Against Women. And there must be complementarities in the ways in which both conventions are read and the ways in which we harmonize the rights and entitlements under both conventions. And at this moment in history, in 2020, we also celebrate the 25th anniversary of the Beijing Platform of Action. And that is one of the most important tools, one of the most powerful tools to address women and girls with disabilities. In fact, the Beijing Platform for Action has 24 references to persons with disabilities. And the Sustainable Development Goals have 7 targets that refer to disability and 11 references made on disability. So my question to Mr. Takashi Itsutsu, who is the director of UNITAR and the University of Tokyo Forum on Diversity, Disability and Inclusion, and a long-time friend and much admired colleague of mine, Dr. Takahashi, I am so delighted that you are participating in this conversation today. What I would like you to do is to share with us your thoughts on how the 2030 agenda and its targets, the 7 targets on disability, can be read along with the Beijing Platform of Action as we commemorate the 25th anniversary. And how do we address building back better within the context and the framework of the 2030 Agenda and the Sustainable Development Goals?
Thank you very much, Professor Rangita, for your kind introduction. And first of all, I would like to deeply thank our co-organizers, UN Women and STEP, and the distinguished panelists and participants for this important opportunity to get together. In particular, I'm very grateful for Ms. Abia and her team for their leadership and coordination in realizing this event. And today, I would like to talk about the leadership of women and girls with disabilities in building back better through prioritizing emotional well-being and intellectual and psychosocial disabilities. I would like to share my slides. Just one moment, please. Okay. I would like to start with basic facts of mental health and psychosocial well-being. According to WHO's World Report on Violence and Health, while the annual number of deaths due to wars is about 300,000 and murder-related deaths is about 500,000, suicide deaths is about 800,000 a year in this world. People are dying due to suicide more than wars and murder. We have Security Council, peacekeeping operations, and military for preventing and responding to wars and conflicts, and we have law enforcement, judicial, and correction systems in most countries. However, the international communities and local system tend to have left behind the mental health and psychosocial needs of many people for too long. According to WHO, 1 out of 4 of us experience mental health conditions at least once in our lifetime. And human beings, all of us are emotional beings. And the economic costs of neglecting mental well-being is huge. According to OECD, direct and indirect costs of mental health conditions exceed 4% of GDP. But at the same time, according to WHO and the World Bank, investment in mental health, investment of $1 in mental health will return as $4. Promotion of mental health and well-being was finally integrated into the Sustainable Development Goals, SDGs, as a key global priority in 2015 as a result of tireless efforts by various stakeholders, including organizations of persons with mental health conditions or psychosocial disabilities. And looking back, women's rights movements and disability movements played significant roles in realizing this. For example, according to the Mental Health, Well-being and Disability key UN resolutions and documents publication published in 2015, 1/3 of UN resolutions in which mental health, well-being, and disability was discussed were in the context of areas concerning women and children, such as violence against women, sexual violence, the girl child, and traffic in women and girls. In addition, discussions at the Commission on the Status of Women, CSW, and the Committee on the Elimination of Discrimination Against Women, CEDAW, started to discuss the importance of mental health and psychosocial well-being. as frontrunners decades ago. And UNFPA was one of the first implementing arm of the UN to have integrated promotion of mental health and psychosocial support in its strategic plan as early as 2007 in the Millennium Development Goals MDGs era in the context of maternal depression and psychosocial support after sexual and gender-based violence, as well as humanitarian emergencies. The disability stakeholders played key roles too. The UN Secretariat, together with the World Bank, UNU, WHO, and the civil society organization, have organized various key events and issued publications in conjunction with the CRPD Conference of States Parties, International Day of Persons with Disabilities, among others. The COVID-19 pandemic has been a reminder how human beings are emotional beings and how mental health and psychosocial support is essential for all people, including persons with disabilities. In May this year, the UN Secretary General issued a policy brief on a disability-inclusive response to COVID-19. The policy brief was very instrumental in promoting disability-inclusive COVID-19 response in many countries. And we have organized a series of online initiatives based on the policy brief, together with the President of the Committee on the Rights of Persons with Disabilities, UN Secretariat, including the Executive Office of Secretary General and DESA, UN Women represented by Monju, UNFPA, representatives of organizations of persons with disabilities, private sector, and young people. The SG's policy brief states, measures to contain the spread of COVID-19 have resulted in significant disruptions to services, support systems, and informal networks, such as psychosocial support. And mental health and psychosocial support needs to be accessible and not discriminate against persons with disabilities. In the same context, the policy brief highlights greater marginalization of persons with intellectual and psychosocial disabilities who are more likely to be excluded from services, live or be detained in institutions, and experience higher rates of violence, neglect, and abuse. The SG's policy brief also points out that persons with intellectual and psychosocial disabilities are overrepresented in the prison population. In addition, persons with disabilities, including persons with intellectual and psychosocial disabilities in other institutional settings, such as nursing homes, social care homes, and psychiatric facilities, as well as detention facilities and penitentiaries, experience significant barriers to implement basic hygiene measures and physical distance, and have limited access to COVID-19 related information, testing, and healthcare. Women and girls with intellectual and psychosocial disabilities tend to face more barriers and further marginalization. Here, I would like to touch upon the current states of the rights of persons with mental health conditions or psychosocial disabilities. According to the UN reports, 80% of state parties of CRPD have legal restrictions on voting rights for persons with mental health conditions or psychosocial disabilities. About 40% of countries deny right to marry or persons with mental health conditions or psychosocial disabilities. Half of CRPD states parties permit dismissal from work due to mental health conditions or psychosocial disabilities. And as a result, as much as 90% of persons with severe mental health conditions are unemployed. And many children with intellectual and psychosocial disabilities are excluded from education. And 80% of persons with mental health conditions do not receive appropriate health services in developing countries and suffer from over-medicalization and unnecessary institutionalization. Persons with intellectual and psychosocial disabilities face elevated risks of sexual violence, physical assault, and even murder. And according to OECD, as a consequence, persons with severe mental health conditions die 20 years earlier than those without. And importantly, again, women and girls with intellectual and psychosocial disabilities tend to face multiple and further barriers and exclusion in all of these. We have co-organized 2 side events in addition to this one on the intersection between peace, diversity, and disability, and the other on the youth voices and actions in intersection of disability and other marginalized populations in this Conference of States Parties. In the side events, many panelists highlighted the importance to prioritize emotional or mental and psychosocial well-being as the foundation of peace, sustainable development, and protection and promotion of the rights of persons with disabilities. As women's rights movement and disability movement together led the mental health and well-being, as well as the rights of persons with intellectual and psychosocial disabilities get out of marginalization and neglect and become global priorities, it is high time to move into implementation and realization of mental well-being on the ground in the efforts to build back better through the leadership by women and girls with disabilities, mobilizing various partners. Trust, fear, anxiety, anger, and love, all of these are emotions, and they determine our thoughts, attitude, behaviors, and our future. There are many things that we can do now. For example, psychological first aid, PFA, is a humane, supportive, and practical assistance to fellow human beings who recently suffered a serious stressor, which can be delivered by anyone. Learning about it via the booklet or e-orientation could be useful. And in our efforts to build back better in the COVID-19 response, we need to start to include indicators on emotional well-being together with GDPs and mortality, since it will be one of the key factors which reflect the states of inclusion and our overall quality of life. With prioritizing these emotional and mental well-being, as well as the rights of persons with intellectual and psychosocial disabilities, I believe we can build back our society more inclusive, kind, comfortable, and peaceful in the mind of each one of us. Thank you very much.
Thank you, Dr. Takahashi, for this powerful presentation on mental health and psychosocial disability as part of the peace and security agenda as an imperative of the Sustainable Development Goals. Mental health and psychosocial health has become, as you pointed out so powerfully, a bedrock of the peace and security agenda and in building back better. And the ways in which you have described it shows that more lives are lost because of mental health and psychosocial disabilities than during war and in conflict. So if we are building back better to address some of the most acute problems that the world faces, I think our attention and our economic resources must go to addressing mental health and psychosocial health. Thank you so much for bringing this powerful issue to the front and center of this debate. So on that same point and building off of Dr. Takahashi, I'd like to turn to Zara Todd, an eminent disability rights activist, to look at how the pandemic is intensifying mental health and psychosocial disabilities. We have a rough estimate that over 1 billion people have some form of a disability. But I think what we will find is that building off of the pandemic and in a post-pandemic world, the numbers will be much higher because the pandemic itself is creating mental health and psychosocial disabilities. So my question to Zara is, given that people with disabilities and women with girls with disabilities are among the hardest hit by COVID-19, and that they also lack access to public health information, significant barriers to implement basic health measures, how would you suggest, as a woman disability rights activist, that women and girls face this crisis and face this crisis in a way that not only ensures that their health needs, both mental and physical needs, are addressed, but that they can be, like you, advocates for other women and girls whose mental health and psychosocial health will be at greater risk during a time of pandemic, during a time of a black swan event. Zara?
Thank you very much for inviting me to speak. Um, as many of the speakers have already said, COVID-19 has exacerbated existing inequalities that disabled women face. In the UK, disabled women were disproportionately affected by COVID-19. 11 times more likely to die from COVID-19 than a non-disabled person, and which compares to 6.5 times more likely for disabled men. What this shows is we really need to be collecting disaggregated data on gender and disability so that we can show how the intersections of identities affect how you experience the world and your life chances. One of the things that's really clear as a disability activist is that we need to ensure that countries have contingency plans for unexpected events like COVID-19 so that basic healthcare can continue to operate and so that people can not be disproportionately disadvantaged by needing care and support and having ongoing health conditions. What is clear from at least what has happened in Europe is that institutions are breeding grounds for COVID-19 and do not work in terms of disabled people's rights and experience. I think a key consideration going forward, if we're to build back better, is to think about what COVID-19 and the lack of infrastructure has done to gender roles and how we understand, particularly disabled women's responsibilities within society. I have heard from a lot of disabled women I've been doing research with that they are finding that the crisis caused by the pandemic has led to gender roles being more asserted than ever. So if you are a disabled woman with caring responsibilities, you are expected to disproportionately respond to that in comparison to both non-disabled women and disabled men. And I think there needs to be work done to ensure that the progress that we've made around gender equality more broadly, particularly for disabled women, is not set back by what has happened during the pandemic. There is a lot of evidence that the lack of provision of childcare has meant that disabled women have had to stop working and doing other things in order to deal with the consequences of the pandemic. I think another key issue that the pandemic has shown is we really need to work on inclusive and accessible information to ensure that all members of society are in a position where they can protect themselves and understand the limitations of situations like COVID. One of the things that's clear is at the moment, women and girls with psychosocial disabilities and intellectual disabilities are far more likely to contract and potentially die from COVID-19 than other groups. And I suspect that a large proportion of that is due to a lack of information around how to protect themselves. I think it's absolutely key to go to the starting point of where I started, that we're collecting data and collecting experiences of disabled women, because often when I look at the data that's around available on COVID-19, it lacks the intersectional approach of covering both gender and disability, which means that it will be harder to justify and advocate for specific interventions for disabled women going forward as we build back. The more information that we have, the better we can build back for those that experience multiple oppressions. Thank you.
Zara, what an powerful presentation. And the ways in which you have described the way in which women and women with disabilities face disempowerment because of COVID, not only in terms of their health, but in terms of their economic health, the way in which they've been marginalized from the marketplace because of their disproportionate caregiving roles, will continue to highlight stereotypes about gender and women with disabilities, and to refine and reproduce the traditional roles of women in a way that is both disempowering and also impacts the agency and the leadership of women and women with disabilities in the public sphere. So now I want to turn to Abia Akram, who is our leader, who has really helped to convene this important conversation and who has been the force behind this conversation. So Abia, as the global chair in the Global Youth Council and the UNICEF Coordinator South Asia Disability and Development Initiative Project, what I would like you to focus on is the way in which women and girls face a greater risk of domestic violence, which has surged during this pandemic. As Zara so well pointed out, girls and women with disabilities face a greater risk of being sucked into traditional roles of caregiving and being paralyzed by these roles in a way that disempowers them. I want you to look at the ways in which COVID-19 faces a greater risk of violence and sexual abuse, and how in building back better, we can address that specific threat that women and girls face in terms of violence.
Yeah, thank you so much, Dr. Angita. Thank you very much for your support and hosting the whole conversation. Thank you. I'm really grateful to all the partners of the event who have helping us to organize this, especially UNITAR, University of Tokyo, UN Women. And I'm also grateful to Akiko Ito-san because she has under her leadership, we have been able to, while we are celebrating the International Day of Persons with Disability all over the world, we are at the same time talking and bringing the voices of women with disabilities and all the key stakeholders. So thank you, everyone. From the perspective of women and girls with disability, as our fellow speakers have rightly mentioned, it's about policy to the implementation and bringing the voices from the grassroots level, how we can make a connection between that. We have the UN Convention on the Rights of Persons with Disability. We have clear recommendations on the Sustainable Development Goals and also the Beijing 25 Plus Review platform. So how we can make a connections between CEDAW and CRPD and see women and girls with disability take the leadership role, and they can play important advocacy and the role to highlight their concern by their own, because we have seen from the disability movement, from the gender movement, in both persons with disabilities are getting some space. We every year we organize the conference of state parties and have very rich discussions, and it is important to give the equal space to women and girls with disability jointly. So creating, as we discussed about the global network of women with disability, This is really important. In that way, we can create the synergies on the regional level, but at the same time, we can get the opportunity of the state who is responsible and taking the interest and the political will because of the sustainable development goals. So how we can use that opportunities and link it with the women and girls with disabilities, and through the global network we can advocate for their rights, and they can more explore the share their experiences, and also bring those international and the global talk in the regional and on the national level. So at least the women and girls with disabilities who can face discrimination or the violence and harassment, they can live a dignified life on a jointly connected way with different stakeholders. From perspective of the COVID-19, I would completely agree with Zara, because we have witnessed from the regional and the country's level how women with disabilities were excluded from the discussions, from the planning, from the implementation of the plan, and access to the basic services like health, education, and they were not able to get any opportunities for the employments, and it's an extra burden on the families, and they were not used to stay together before the COVID-19, and once the pandemic happened, everyone have to stay back at home, and it was really challenging for women with disabilities. They were the first one who get sexually harassed, face gender-based violence. Even we met with many of the women with disabilities families, and they were saying like, we don't have any option to go for the forced sterilization, or just confine those women with disabilities in one room and that's it, because we don't have any other solutions to assist them. But we were very fortunately worked closely with the government officials, and we tried to link with that. One of our parliamentarian is also part of the discussion, Ms. Zalehuma, and she also herself tried to support the women with disabilities groups, how they can bring the challenges and that on the table, and we can talk about it. So we have established a peer support group virtually to support those women and girls with disabilities by themselves. So we trained them, and then they provided that opportunity. But I'm going back again on the regional and the global level, because I thought from where we can create the toolkits, the research and the data collection is very important. So how we can do the research on where we can identify those gaps and link with the policies, and also from the humanitarian perspective we can talk about the development solutions for it, and we can see different stakeholders, especially UN Women, UN UNITAR, how we can collectively work on the rights of women and girls with disability and provide them the opportunities to live a dignified life. Thank you.
Thank you, Abia. You did a wonderful job of looking at the inextricably interlinked nature of the CEDAW and the CRPD and the Beijing Platform of Action. And I would also like to add one other convention that you work with at UNICEF, which is the CRC, the Convention on the Rights of the Child, because we are also talking about the girl child. And the abuse and the sexual harassment and the violence that the girl child faces during a time of school closure. We have to focus on the ways in which COVID-19 has exacerbated the exclusion of girls with disabilities from formal education, and the ways in which that creates a heightened threat of violence against women, including early child marriage and genital mutilation. So we have to be aware of the ways in which we can link all of the conventions in the way in which you have done. You also mentioned how women and girls with disabilities have been excluded from the planning that has gone on in Building Back Better. And so we have to ensure that Building Back Better doesn't further exclude women and girls with disabilities and further marginalize these important voices from, as you said, being at the table on issues that so profoundly and fundamentally impact them. And for that, as you mentioned, Abia, we need political will. And that is why it is so important to have with us Ms. Zilhuma, who is a political leader, a member of parliament, a member of the National Assembly of Pakistan, because we are really at the final analysis speaking about political will, about decision makers being able to work together in consultation and in engagement with women and girls with disabilities to ensure that the rights of persons with disabilities are at the center of both COVID-19 responses and the recovery efforts and in building back better. So, Ms. Huma, Member of Parliament in Pakistan, my question to you is, as governments are urged to place people with disabilities at the center of this debate on building back better, can you share with us some concrete steps that you hope to take in Pakistan on ensuring that the voices of persons with disabilities are mainstreamed into the planning on building back better?
Thank you for giving me the opportunity to speak about the policies which the government of Pakistan has taken to incorporate the issues of people with disabilities into the planning debate. The COVID-19 pandemic has hit almost every country very bad, especially developing countries like Pakistan, where there are approximately 33 out of the 222 million people, the 33 million people who are disabled, and out of those 33 million, 60% of the women are disabled. The current government has incorporated the issues of disability and people with disabilities into the debate regarding development. The current Speaker of the National Assembly has taken a personal interest in incorporating issues of disabilities and the problems of people with disabilities into the policy framework, as his own daughter is disabled. Me, myself, I had been disabled for the past 11 years. I had faced an intense disability in which both of my hip joints were expired, and I had to suffer a lot because my mobility was seriously restricted. I couldn't do basic tasks which I used to take for granted. After my I just had a surgery last year where both of my hip joints are replaced. So for me, for me to understand the pain of disability is more on a personal level. Therefore, me being the member of the Parliament this year, most of my work has been focused on helping people with disabilities, bringing the issue of disability to the mainstream agenda, bringing it into the political debate. For that, we have formed the committee on we have formed a special committee for disability, which I'm the co-chair of, and we are going to have a first meeting of it soon. It's expected to occur soon, but currently, since we are in sort of a lockdown, the progress has been restricted. But we are working on it. We are trying on it. Apart from that, on a personal level, I'm trying to work with health care facilities for disabled people. We have been trying to focus more on upgrading the services providing in government hospitals, which are more accessible to the poor and marginalized people. Apart from that, since I'm the convener of SDG goal number 10, reducing inequality, we have tried to bring the issues of disability and how policies related to disabilities needs to be more inclusive into the SDG agenda as well. Yeah, so if you have any other questions.
So this has been so evocative, member of parliamentarian and decision maker Huma, because when we talk about the importance of leadership for women with disabilities, we are talking about you, Your Excellency. And I want to make sure that you are addressed in a way that we elevate your leadership. You are a leader at the table, and you're also a woman with disabilities. And we need to see more of you being replicated and multiplied around the world. And what you have done is to give voice for other women with disabilities by representing them in Parliament. And by providing resources, programs, and policies in a way that really strengthens structural, institutional, and systemic change. So you are the kind of leadership that we want to see in building back better. So in conclusion, I want to look at very quickly some of the pillars of the Sustainable Development Goals in terms of a post-pandemic building back better society. So in Goal 8, we talk about decent job creation, entrepreneurship, and the ways in which young persons and persons with disabilities must be part of the economic participation that needs to be spurred during a Building Back Better initiative. Goal 9 talks about innovation, and innovation is key in addressing issues like what the parliamentarians spoke about. There is right now an enormous revolution taking place in the world of technology. Artificial intelligence has been a tool that is considered a tool that's going to tackle inequality. So AI for accessibility can be an enormously important tool for women and girls with disabilities, but it is also a double-edged tool. It can create divisions and deepen the polarization and the balkanization between persons with disabilities and their peers who may not have a disability. So how can we ensure that AI for accessibility remains equal and remains a program, remains an innovation that is driven by women and girls with disabilities? If not, we are going to bake our biases into the artificial intelligence. That the biases will have a trickle-down effect. It will seep into artificial intelligence. So when we are building back better in a post-COVID world, which is going to see an efflorescence of and a blossoming of new technologies, how can women and girls be at the table in developing the software and the technologies for a more equal world? And then finally, what Dr. Takahashi said about how women and disabilities need to be at the epicenter, become the bedrock of Goal 16, which is about promoting peaceful and inclusive societies. And in promoting peaceful and inclusive societies, we have to ensure the mental health and the psychosocial health of all persons, including women and girls with disabilities. So peace and security must be seen within the same framework as mental health and psychosocial security. And so I can't do better than echo the words of Gerard Quinn, who is the Special Rapporteur on Disability, when he said, "The future cannot be like the past." And that is what building back better should be all about. So with that, I want to thank all of our esteemed panelists for their insights, for the work that they are doing to reshape the future, to build back better, and to reimagine a new world and a new global order that is built on multilateralism. It is built on the kind of cooperation and a world that looks at a rules-based global order that eschews populism, nationalism, chauvinism, but really looks at the global village as interconnected and looks at disability rights and persons with disabilities as leaders in building back better, because the future cannot be like the past. So with that, I'm going to turn it over to Abia, our leader, who brought us all together for final words and to conclude this important conversation. I don't hear Abia, so I'm going to turn it over to Dr. Takahashi. Oh, Akiko Ito. Akiko Ito is our leader, and I finally get to greet her as somebody who's not only led this particular conversation, but who's really created the structures and the foundation for the Convention on the Rights of Persons with Disabilities and for actualizing the rights in the convention. So I am so thrilled and honored that Ms. Ito has joined us now in person. Well, we can actually meet her and greet her and thank her for all of her leadership in the progress that has been made in the rights of women and girls with disabilities. The idea of the intersectionalities of women and girls with disabilities is an idea that Ms. Ito had really seeded. She is the one who came up with this idea of the intersection of women and girls with disabilities as an important normative framework in the convention. So I want to once again honor her and celebrate her work and ask her to make the concluding remarks.
Thank you.
No, I think Ms. Abia Akram should have the final words, but I just wanted to express our great appreciation to this extraordinary important contribution to the Conference of State Parties of its 13th session this year, and as well as the International Day. We actually owe it all our progress to all of you, especially Dr. Rangita De Avis and Dr. Izuzu, who have led the past decades of bringing the voices and the perspectives and rights and well-being and all our intellectual resources for the benefit of promoting the rights of persons with disabilities and inclusion of all people in our global agenda. And then I would just want to thank you all. And as just the last, I think the thought, just listening to Professor Rangita De Alves, I think the most important, again, would be to secure space, global space, regional space, and local space for women and girls with disability to take the leadership in a unique space that could bring in disability rights, again, disability rights leaders, and women's rights leaders. So thank you so much.
Thank you. And I think that reminder is so important, because most often our movements, our global movements, are also polarized. And when we think of the global women's movement, we need to think of the role that women with disabilities play in the global women's movement. And similarly, we need to look at the ways in which women with disabilities play in the disability rights movements. So we need to ensure that our movements are inclusive, and that these social movements are interconnected, because we are speaking about building back better and a better future for all. So Abia, final words, and we conclude this important conversation.
Thank you so much. Thank you, Dr. Angita, and thank you, Ito-san, for your words. This is really important for us. Thank you. I would say thanks to all the panelists, because this is like amazing. You have mentioned and showed your commitment towards the work on women and girls with disability, and we are really seeing the role of all the stakeholders, how we can take this forward, and especially giving the voices to women with disabilities on the regional and the local level. And we are really seeing the global network of women with disability can provide the leadership role. We can build the capacities of women and girls with disability to understand the legislation, understand the perspective in in easy to and accessible formats. And on the other hand, the other organizations and the UN systems need to be more like inclusive and giving more space to women and girls with disabilities, so they can actually contribute, so they can have a meaningful participation and meaningful role in the process. So thank you very much. Thank you, Takashi-san, for all your support and co-sponsoring the event. And thank you, Dr. Angita, for your time. It was amazing to have you as a moderator. Thank you very much. And thanks to all the speakers, especially the UN Women and the CRPD committee and Zara. Thank you. Thanks to everyone. And we are really hopeful to, this is the beginning where we have discussed, and now we are going to move together in future to see more productive work. Thank you very much. Thanks.